Right now, 1 in 3 adults reading this has a disease quietly damaging one of their most important organs, and most of them have no idea. It doesn't come from alcohol. It doesn't cause pain. It doesn't show up on a routine blood test until it's already done serious damage. It's called fatty liver disease, and it's now the most common liver condition on the planet, overtaking hepatitis and alcohol-related liver disease combined. The scary part isn't that it exists, it's that it's almost completely reversible, if you catch it in time. Today, I'm going to show you exactly how this disease develops in silence, the early warning signs your body is already giving you, and the science-backed window you have to reverse it before it becomes permanent. Stay with me until the end, because the third warning sign is the one almost everyone misses. Hello and welcome back. I'm Dr. Caleb Parker, and for the past 2 decades, I've studied and treated conditions that hide in plain sight. Diseases that don't announce themselves with pain or dramatic symptoms, but instead work quietly in the background until the damage is severe. Today we're talking about one of the most underdiagnosed conditions in modern medicine, non-alcoholic fatty liver disease, now more precisely called MASLD, metabolic dysfunction-associated steatotic liver disease. I know that's a mouthful, so let's break down what it actually means, why it's exploding in prevalence, and, most importantly, what you can do about it starting today. What fatty liver disease actually is. Your liver is one of the hardest working organs in your body. It filters toxins, produces bile for digestion, regulates blood sugar, and metabolizes fat. But when your liver takes in more fat than it can process, that fat starts to accumulate inside liver cells. A small amount of fat is normal, but when fat makes up more than 5% of your liver's weight, that's when doctors classify it as fatty liver disease. Here's what surprises most people. You don't need to drink alcohol to get this. In fact, the non-alcoholic version of this disease is now far more common than the alcohol-related type, largely driven by insulin resistance, obesity, and diets high in processed sugar, particularly fructose. Why it's called the silent disease. The liver has no pain receptors in the areas where fat typically accumulates. This means the early and even moderate stages of fatty liver disease produce no symptoms at all, no pain, no digestive issues, no warning signs that something is wrong. Research published in the Journal of Hepatology has shown that a large percentage of people with fatty liver disease are only diagnosed incidentally, during an ultrasound or blood test ordered for a completely unrelated reason. This silent progression is exactly why the disease has been allowed to spread largely unchecked. Global health data now estimates that fatty liver disease affects roughly 1/4 to 1/3 of adults worldwide, with even higher rates in populations with high rates of obesity and type 2 diabetes. The progression. How silence turns into damage. Fatty liver disease doesn't stay static. Left unaddressed, it can progress through several stages. Stage 1 is simple steatosis, fat accumulation without significant inflammation. At this stage, the condition is highly reversible with lifestyle changes. Stage 2 is steatohepatitis, where the fat buildup triggers inflammation and liver cell damage. This is where things start to become more serious, and where the disease picks up the name MASH, metabolic dysfunction-associated steatohepatitis. Stage 3 is fibrosis, where the liver begins forming scar tissue in response to ongoing injury. This scarring is partially reversible, but it takes real intervention and time. Stage 4 is cirrhosis, extensive, largely permanent scarring that severely impairs liver function and significantly raises the risk of liver failure and liver cancer. The critical point here is this. Stages 1 and 2 can often be fully reversed. Stage 3 can be substantially improved. But once you reach cirrhosis, the damage is largely permanent. This is why early detection isn't just helpful, it's the entire game. The 3 warning signs your body actually gives you. Even though fatty liver disease is often symptomless, your body does give subtle clues. Most people just don't connect them. The first sign is persistent fatigue. Not the ordinary tiredness from a poor night's sleep, but a heavy unexplained exhaustion that doesn't improve with rest. Studies have linked this fatigue to the metabolic and inflammatory changes associated with liver fat accumulation. The second sign is mild discomfort in the upper right abdomen. As the liver enlarges slightly from fat accumulation, some people notice a dull sense of fullness or pressure just under the right ribs. It's easy to dismiss, and most people do. The third sign, and the one almost everyone misses, is a cluster of metabolic red flags that show up on routine blood work long before liver enzymes rise. This includes elevated triglycerides, low HDL cholesterol, borderline fasting glucose, and a waist circumference that's expanded even without major overall weight gain. Because these markers get evaluated individually rather than as a pattern, doctors and patients alike often miss what they're collectively signaling: a liver that is struggling to process fat properly, who's actually at risk. The traditional image of liver disease, someone who drinks heavily, has led to a dangerous blind spot. The people most at risk for fatty liver disease today are often those who appear outwardly healthy. Risk factors include insulin resistance and prediabetes, central or visceral obesity, high intake of added sugars, especially fructose from sodas and processed foods, sedentary lifestyle, and metabolic syndrome. Genetics also play a role, and certain populations carry gene variants such as PNPLA3 that increase susceptibility regardless of body weight. This means even people at a normal weight can develop the condition, a form sometimes referred to as lean MASLD. The reversal window. What the evidence actually shows. Here's the encouraging part, and it's backed by solid clinical research. Multiple studies, including trials published in Gastroenterology and The Lancet, have shown that a sustained weight reduction of just 7 to 10% of body weight can significantly reduce liver fat, and in many cases, reverse early-stage inflammation and even some fibrosis. The most effective interventions are not exotic. They include a reduction in added sugars and refined carbohydrates, regular physical activity. Both aerobic and resistance training have shown measurable benefit, a dietary pattern similar to the Mediterranean diet, which has strong evidence specifically for liver fat reduction and improved sleep quality, since poor sleep is independently linked to insulin resistance. Emerging medications, including certain GLP-1 receptor agonists, have also shown promise in clinical trials for reducing liver fat. Though lifestyle intervention remains the foundation of treatment and prevention. How to actually know where you stand. If you suspect you may be at risk, the most accessible first step is a simple blood panel checking liver enzymes, ALT and AST, along with a metabolic panel covering triglycerides, HDL, and fasting glucose. For a more direct look, a liver ultrasound or a specialized test called a fibroscan can assess both fat content and the degree of stiffness, which correlates with fibrosis. These are widely available, non-invasive, and something you can request during a routine checkup. Closing. What makes fatty liver disease so important to understand isn't just how common it's become. It's how quietly it progresses and how much control you actually have over its outcome. Your liver is remarkably resilient. It's one of the few organs capable of genuine regeneration. But that resilience only works in your favor if you catch the problem while it's still reversible. If this video helped you understand something new about your own health, consider sharing it with someone who might need to hear it. And if you want more evidence-based breakdowns of the health conditions hiding in plain sight, subscribe. Because next time we're covering a topic that affects nearly everyone but gets almost no attention: insulin resistance and why your doctor may never test for it. I'm Dr. Caleb Parker. Stay informed, stay well, and I'll see you in the next one.